So, hi everyone. I am very, very proud to have an experience with Dr. Noorpinder Kaur. She has got an amazing score of 202 in her first attempt. So, heartiest congratulations, first of all.
Thank you so much, ma'am.
So, she was our Bhatia student. Yes. So, Noorpinder, can you share your journey with us?
Yes, ma'am. First of all, I really want to thank each and every teacher because whenever we ever felt like something is not good, they were always there to support us. And they were always saying, just read our notes, everything will be from there. And when we went for exam, really everything was from there.
Yeah. So I think that's a great relief that you know that your source is perfectly fine and you have to stick to it.
Yes, ma'am. Teachers always used to say that one source and multiple revisions, and that's what we followed.
Okay. So from where did you started the classes?
I joined a little late. When I joined, there were some off days, so I started with ophthalmology. And but For preparing for FMG, I started when I was in my third year. From that time I started, like, we had tests in our university, so I
Mhm.
used to study for them also. And then after, when I came back to India, then I was not joining any coaching. I thought that I can do it on my own. But some days passed, like 10-20 days. Then I was like, no, I need some guidance. And everyone needs that guidance. So I thought of joining it because my brother, he's also studying in Russia. So because he was like, okay, I will not study. He was like that. So we booked these classes for him, and I asked him, are these classes good? He said, yes, absolutely good, you can join. Then I joined them, and really I got a direction, and today I'm here.
Okay. So how did you like the classes, Noorpinder? How was your experience in the classes?
It was very nice, ma'am. Like, there was online chatting on Telegram. If we
Mhm.
don't understand anything, we can say the teacher and they will explain it like very nicely.
Okay. So which classes did you like the most?
I liked all the classes. Like, all
Okay.
teachers are really good, really nice. I
I
can't be
think
biased
if the
here.
person is not able to point out that these classes were best, I think it says everything that every class was good. That means.
Yes, ma'am. Every teacher is amazing, good, and they always used to say one source, multiple revisions, and your PYQ topics should be very strong. And this is the strategy that I used.
Hmm.
And I really want to thank my parents also, because when this exam was rescheduled, my brain was really tired, and
Hmm.
I was not for 2-3 days I was not even studying. So I didn't tell anyone. But at the end, I told my mom, and she said that, relax, world will not end if you will not pass. Just give your best
Hmm.
and do however and how much you can. So, ma'am, I did that, and I really want to thank everyone who supported me, my teachers, my parents, and first of all, God.
Yes, obviously. So, Nurpinder, because so many people think that we may do alone and then they require some guidance. So, what would you like to say? Like, how much you improved in your concepts during the classes, and what was the journey like? Like, were your queries solved? How much of the paper came from the classes?
Yes, ma'am. Like I told that, first I thought that I will do everything on my own. I will not join any coaching,
Mm-hmm.
but there was no guidance, no direction. One day I was doing one subject and I was getting bored. But when we join classes, like, there we get a proper schedule. Like, you will, for these days you have to study this, and you have some off days.
Mm-hmm.
On those days you can revise that subject, and you can, like, attempt PYQ questions. So And there were many things that when I was preparing on my own in my third year, fourth year, fifth year, sixth year, I didn't get them. Like sometimes there are some subjects, some topics that you need that someone explains to you, then you get them really well. So there were many topics that were cleared. I was like, oh, अच्छा ये ऐसे होता है.
ऐसे होता है. Okay. So you got all these concepts in the classes.
Yes, ma'am. And exam, I will say that there were a lot of questions that were from our classes. Like I can recall that CRVU was there,
Yes.
then copper in Wilson's disease,
Yes.
then injury in eye that you told, and ma'am pheochromocytoma. Like I will say that PYQ topics are really important because if the question will not repeat, but the something from the topic will definitely repeat. And that what teachers told us. Like when I was preparing, I didn't know that, and I was thinking, हाँ, ऐसे तो नहीं आते, पिछले साल के questions तो नहीं आते, but they
But
really
आते
came
हैं.
and I was really happy. Yes, ma'am, वो आते हैं.
लेकिन आते हैं. अच्छा, तो Noorpinder, if I ask you that, tell me in percentage, how much paper do you think was from classes? And if you only do these notes, then will you be able to solve all the questions in the exam?
I think, ma'am, one can solve 60% because I only did Behtareen Bhatia notes and PYQ questions. No other like apps, no questions from there. I had apps, but I didn't use them when there was peak
I
time
think
for my
this is a very important point. Like there is no point in hiding. We have so many platforms, but the thing is that which actually helped you and which actually came to your rescue. We have the things from multiple sources, but actually you should know one source that is reliable, that is good enough, and you know कि जो यहाँ बोला है कर लिया तो we will get there, we will get through.
Yes, ma'am. Like I had 4 notebooks from Behtareen Bhatia. I was just revising them, doing PYQs. That's it.
That's it. And
yes,
and that too, you are not just pass. You have made a marvelous score. So that means if you just stick to the notes, you do whatever is being told by the faculty in the classes, you will be there.
Yes, ma'am. Okay. When I studied there, I didn't revise anything. Like that was my problem, that I was not revising. Like now some people will have exam after 4 months now in June.
Yes.
But I want to say them that don't panic. There is no need to panic because with a good source and with PYQs, you can do it even in 3 months, I will say, and you have 4 months. Just start preparing from now and you will pass.
So did you give the test also?
Yes, ma'am.
Okay. So how did you like the test? Were the questions similar to the main exam?
Yes, ma'am. Like I will be really frank that test of DBMCI are difficult than any other platform, but that is important because when me and my one friend, when we were doing that, we were thinking, yeah, questions to mushkil hai. But then I thought that if we are finding these questions difficult here, even if in exam questions are easy because seniors told them their paper is really easy, but the pressure in our mind will make those easy questions really difficult. So let us attempt these difficult questions so that we will be relaxed there. Okay, ये तो आता है.
Exactly, that is the point. अगर आप easy करके जाते हो और difficult आते हैं exam में, then you are under pressure. But on the other hand, अगर आप difficult करके जाते हो और easy आता है paper में, then you are having an extra edge. आपको ऐसा लगेगा कि ये तो चुटकी में हो सकता है. You are already prepared for one step higher. तो हम लोग भाटिया में हमेशा ये try करते हैं that the students are prepared for even a step higher. अगर इससे मुश्किल पेपर आता है तब भी आप करके आते और तब भी इतने ही अच्छे मार्क्स लाते जितने की अब लेके आए हो.
Yes, ma'am. That's what I understood after giving the test.
Okay.
I am getting 60% here or 50% or 55%, then I'm gonna get more in exam.
Yes,
Because
exactly.
these tests are difficult.
Yeah.
You have to use your brain a lot.
So I think, Noorpinder, now there is a different trend also. Even FMG exam maybe now you are not getting only one-liners. Gone are the days. जब only
Yes, ma'am.
one-liners आते थे and people used to just cram those one-liners and used to attempt. लेकिन अभी क्या है? We have a conceptual paper. And at Bhatia, we are always, insisting on the concept. अगर आपको concept पता है तो आप easy भी कर लोगे, आप clinical भी कर लोगे. But अगर आप सिर्फ रट के आए हो one line, तो obviously you cannot do all the questions.
Yes, ma'am.
Okay, so any message that you would like to give to your juniors, because there are so many people who could not make this time, and your colleagues, some important message to all of them?
Ma'am, I just want to say, first of all, if one didn't do it this time, it means it was not the right time. Next time, they are gonna do even much better than us. I will say that.
Yes.
And ma'am, believe in God. Always respect your parents. That's what I have learned even from Bhatia batch one teacher. He used to say, अपने मम्मा के पैर दबाओ, रात को देखना कहाँ से कहाँ पहुंच जाओगे. Ashwini sir, yes sir. So he used to say that. Like every teacher was always there and they were very supporting. And for my juniors, for those who didn't clear, I will say that okay, इस बार नहीं था, next time you will do much better. And for my juniors, that in whichever year you are, think that time कम है. I always used to think that time कम है, मैं नहीं कर पाऊंगी, पता नहीं बच्चे कब से शुरू कर बैठे होंगे. But when I realized that अगर अब नहीं शुरू किया ना तो बाद में सोचूंगी कि तब क्यों नहीं शुरू किया
तब क्यों
तूने.
नहीं शुरू किया?
Yes. So whichever year you are in, 5th year, 6th year, there is a lot of time. Just start from now. Leave everything. Consistency is the key.
Yes.
Like study every day, even if you get 1 hour, 2 hour, because many juniors, my juniors will be in college. They have classes, tests, many things. Just study every day. Consistency is the main key.
So very nice. I think awesome rank, awesome score, and awesome message. It was very, very nice talking to you. And I think you are an example for all the other students. So thank you so much. And once again, heartiest congratulations from whole of the team DBMCI. I wish you all the very best. And you get an amazing score in your PG also. And again, we are there for your interview.
Thank you so much, ma'am. I really want to thank each and every teacher. They were very nice to us and they taught very well. And they said, "Isi mein se aayega, yahi karke jana." And we did that. And today we are here giving an interview to you. Dream come true. Thank you so much, ma'am. I have no words to thank. I can just say thank you. Thank you, team DBMCI. Thank you, my teachers, everyone. Thank you so much.
Thank you so much. God bless you. Bye-bye.
Thank you, ma'am. Bye, ma'am.
Thank you, Dr. Noor.
Thank you so much.